This Family Life News podcast is made possible by the support of listeners like you.
This is Faith Under Fire. We take you straight to the front lines of religious battlegrounds. I'm your host, news anchor Sarah Harnisch. With me today, Alliance Defending Freedom's Senior Counsel, Matt Bowman. We're talking pharmacists' rights. A few weeks ago, quietly, the U.S. Department of Health and Human Services made a huge decision that affects the religious freedom of tens of thousands of pharmacists across America. This wasn't a court ruling. It was an order directly from the department that oversees our health system across the country. So, Matt, can you tell me what happened with this decision?
Well, this dates back to the Biden administration trying to force all kinds of people around the country to be involved in abortion after it got upset when the Supreme Court overturned Roe versus Wade. Right after that decision in 2022 was the Biden administration using federal agencies, including the one I used to work at, Health and Human Services, decided to start sending letters around the country telling doctors, pharmacists, hospitals they need to be involved in abortion. And one of those letters was a letter to all the pharmacies in the country saying, you need to both stock and dispense drugs that can cause early abortions.
From a pharmacist background, explain what that would look like. If we have an edict like that coming from the U.S. Department of Health and Human Services, what would a pharmacist have to do?
Well, they'd be forced to choose between violating their faith or even their just conscientious respect for human life on the one hand and stocking and dispensing drugs that patients are receiving in order to destroy a young unborn child in the first weeks of life. Bureaucrats in Washington, D.C. do not have the right to tell pharmacists around the country that they have to be involved in abortion just because you don't like what the Supreme Court ruled on in D.C.
And what's pretty spectacular about this isn't a court ruling. This is an edict that came down from the U.S. Department of Health and Human Services. It's huge. I didn't hear much about it, if anything, on mainstream media. Why is this such a big deal?
This is really important. In our lawsuit, the first stage was that the Biden administration tried to ask the judge to dismiss our case, to say we're perfectly allowed to order pharmacists around the country to dispense abortion drugs. And our judge issued a great ruling. He said, I'm not going to dismiss this case. You guys have basically politicized the federal regulatory process. Congress didn't give you the right to issue these mandates, and I'm going to let this pharmacist move forward with his case. And what the Biden administration did at that point was pretty squirrely. They didn't repeal their own mandate. They kept it in place, but they kind of changed the word and muddied the water and said, well, we won't take the mandate away, but maybe we won't violate the rights of Christian pharmacies, and maybe we will, and we're not really sure. And so the whole situation was kind of in limbo for a while. So what was great about what happened a couple weeks ago with the Trump administration now running the Health and Human Service Department is that they just repealed this mandate completely. And they said, we are not in the business of telling pharmacies that they have to dispense and stock abortion drugs. Because of that, because of other reasons, other priorities that the Trump administration has of protecting conscience and religious liberty, they're going to take this mandate down entirely.
So it's 180 degrees the other direction. What happens now?
Hopefully, what we're going to see is that the Health and Human Services Department in the Trump administration is now going to head in the other direction. So I've been working at Alliance Defending Freedom for 19 years, but I took 4 years off and worked at HHS in the first Trump administration. And HHS has a division, and their sole job is to protect the consciences of healthcare professionals, doctors and pharmacists, and hospitals and clinics. And what we've seen in this first year is very encouraging. They have announced that they are investigating a lot of hospitals and healthcare institutions around the country that are violating the religious beliefs of people who just want to work as nurses and doctors and pharmacists. And we're hoping that they will be able to help create or rebuild a healthcare industry that is fully and broadly respectful of conscience and religious liberty and just basic ethics so that people around America can go into the healthcare field. You can go to medical school, you can go be a nurse, you can go be a pharmacist, and you don't have to worry about whether you're going to lose your job or not be able to practice medicine and serve patients because of your faith.
And it starts with the pharmacists, which is pretty incredible. How would this change religious freedom in medicine? What could that look like?
I think it looks like two things. First of all, if you're a young person, you're deciding, I want to go to college, I want to go to my community college, I want to get an associate's degree in nursing or a lab tech. My mom was a lab tech before she retired. I want to go to medical school, I want to be a nurse, I want to be a pharmacist, a physical therapist. But once I get there, is this school, is this institution, and then all the entities that are out there, the big hospitals, as they hire me, are they going to give me a crisis of conscience when I go to work? Are they going to say, well, since you're here, either as a student or a trainee, you have to be involved in things like abortion and changing the sex of young children and all kinds of other things that are harmful to patients and that people shouldn't be forced to practice because they want to help people. And the other side of it is patients. Do you, as a patient, have the option to go to a doctor who shares your deeply held values, or a mental health counselor, or a nurse, or a pharmacy? And are you going to be able to have that choice of, I want to be able to go to someone who I can trust my kids' care to because I know they share my core values, they're not going to be hostile to those. And I think that that's the direction where we really want healthcare to go.
Learn more at adflegal.org.
Thank you for listening to this Family Life News podcast. If you've been encouraged by what you've heard, please share it with others and click the subscribe button to automatically receive future episodes. Family Life is a listener-supported ministry. Podcasts like this are made possible by your financial partnership. Find out more at familylife.org.